Migraines are not just bad headaches, they can be disabling, life changing. And so do not sit in silence and suffer. Seek help. Doctors are out there who can help you and help you live your best and healthy lives.
If you are one of the 1 billion people worldwide who suffer from migraines, you know the feeling before it starts, and all you want is relief, not just from the pain, but from the isolation, the misunderstanding, the invisible weight that you carry every single day. Today, you're not alone. This episode is for you. I'm joined by Dr. Ella Ackerman, a neurologist at VSI and an expert in all things migraines. Hi, Dr. Ackerman.
Hi, Jenny.
I'm so
Thanks
glad
for
we're
having me.
I'm so glad we're doing this.
Yeah.
So it is Migraine and Headache Awareness Month.
Mhm.
And for many, this is everyday life. Unfortunately, it doesn't just stick to 1 month for most people. So I want to talk about migraines, why they're caused, what helps, what doesn't. This is an area, despite the fact that they're incredibly common, that remains really misunderstood for a lot of people. So can we start there? Uh, what is it about migraines that makes them so challenging?
Well, the trouble is that migraines are exceptionally common. And if you're human and you have a brain, you can have a migraine at least once in your life. But whereas for some people it's one and done, or maybe a few in the lifetime and done, for some people they are chronic or they occur on 15 or more days out of the month.
Wow, that sounds awful. Do you have
It's terrible.
before we get to your experience as a doctor with it, I don't have them, but I do love someone who does. What about you? Do you have, and most of us probably do, considering how common they are, do you have a personal experience with them, or do you know or love someone who experiences them? And what's your personal interaction with them?
Well, I'm lucky enough to get migraines
Mhm.
or unlucky, but I'm lucky in the way that they don't run my life, right? For some people, that's the tough part is that they run their lives. And my daughter, who is only 10, already is starting to have migraines. Um,
How often do you get them, and what are they like?
yeah, so my migraines tend to be very cyclical, related to a menstrual cycle, as it is very common for most women, actually. For most women, migraines will have at least some hormonal component, and they're most common in the premenstrual period. That premenstrual period that
Mhm.
women have, those 2 to 3 days prior to the onset of menses, during the menses, or immediately after the menses. That's the most high risk days.
And you said midlife too, hormonal changes in midlife, it can happen then as well.
Absolutely. When hormones start fluctuating more, which is when you hit the puberty and when you hit the midlife, those are the most challenging times for migraineurs usually, and midlife especially,
Before you get
unfortunately.
into what a medical book tells me what it feels like, what does it feel like for you? Or how does your daughter just and or how does your daughter describe it?
So for me, actually, one time migraine really threw me off guard. Honestly, I was a passenger in the front seat. We were driving with my husband, and I thought I started experiencing motion sickness, which sometimes you do, because I was on my phone, I think, during that time, looking up directions. And I was like, well, this is probably just motion sickness. And so I put my phone away, but the feeling just didn't stop. And we were in a stop and go traffic during that time. And I was like, honey, we have to pull over. And I was sick. And I thought, okay, well, that was that.
Mm.
Maybe that's over. And then a very slight headache started, very slight. But then I was like, aha, I think I'm getting a migraine. I don't think it's a regular motion sickness. Plus, it was very unusual for me to be that sick. And so I was like, as a neurologist would, I was like, I'm going to take a Tylenol because what if it's just a migraine?
Mhm. What does it look
That
like
was,
in your child?
oh, my poor child. So when COVID hit and all the kids had to start doing remote learning, I was hoping it was just that because there was so much in front of the screen, and the screen can actually, when you are a migraineur, the more screen time you have, the more likely you're going to get a migraine. And so my child started complaining of blurred vision that would come at times when she was in front of the screen, and a little bit of a headache, not much. And I was very concerned, of course. I was like, "Hmm, let's see how she feels when she's not in front of the screen." And so she was feeling much better. And I was making sure that, she would get enough sleep and everything like that. And obviously, being a neurologist, I examined her from head to toe, made her walk one foot in front of the other, do everything,
Your
right?
mom's a neurologist, it's a thorough
Yeah.
evaluation, yeah.
Yeah, and then now she's 10, she's getting closer to puberty, and we match in our migraines. When I get them, she gets them.
Mm.
It's crazy. And hers are more abdominal because she's a child. So hers are more, "Oh, my tummy's starting to hurt. I am kind of getting a little bit nauseated. I'm not hungry, mom." Like, she'll tell me, "Mom, today is one of those days. I don't wanna eat breakfast today. Everything I'm gonna eat is gonna make me sick to my stomach.
Well,
My
I'm
tummy is
surprised
hurting."
Dr. Akkerman is confusing to me. I don't know that much. I think of migraines as being a headache, and so far with symptoms, you have described a headache, but you're talking about nausea, you're talking about, um, all these different feelings. Is that why they're confusing? And what is the range of symptoms? If we get into the science of a migraine, what is the range of symptoms that people can feel?
Yes, it's very confusing, and that's why, especially if you're not a neurologist, you can think you become very anxious about all these symptoms, right? You think, "Oh my god, am I dying? Do I have cancer? What's wrong? Do I have what's wrong?" And imagine, like, all these moms that become concerned about their children having all these symptoms, right? But then between the symptoms, usually the nice thing is the key factor about migraine. When you're not having a migraine, you feel great,
Okay. And it's not constant, it comes and goes.
especially when it first starts, right? Uh, Very rarely migraine will become chronic right away. All right. Even in the person who is predisposed to having frequent migraines, very rarely will someone just boom and start having daily headaches. It does happen though, unfortunately, and it throws us off guard. And then you get tests from A to Z, from every test on earth, and everything comes back completely normal.
In terms of symptoms, I've got a list here. People may experience pulsing, a drilling pain. It can start behind one eye and spread across your head. Lights might feel like knives. Sounds can become unbearable. Smells like coffee, of food, breakfast for your daughter might make you nauseous. Your vision can blur. Your speech can slur. You want to be in a dark, silent room. I mean, what is happening in the brain that causes all of that?
Yes, so it's a good question you're asking all of this, because even the smartest gurus, biggest researchers in headache medicine are still very confused.
We don't
There are
know the
multiple,
causes.
very confused, because there are multiple theories about where it all starts. But the one that I tend to agree more with, and is a more of a recent theory, is central origin of migraine, that it starts in very deep structures of the brain. Okay. Hypothalamus, thalamus, they sit in the middle of the brain, and hypothalamus is our homeostasis controller, meaning it balances out all of our hormones and all of our chemicals in the body. It all starts in the brain, and it controls our sleep cycle, circadian rhythms. And so the thought is that dysfunction in hypothalamus, or um, I should say, um, abnormal reaction of the rest of the brain to the rhythms of hypothalamus, can set off migraines.
And so common triggers could be things like stress, hormone changes, weather, diet, sleep disruption. It's
Anything,
different, but
basically.
it can be a variety of things and it can be different in every person. Is that right?
Absolutely. And it's genetic. It really is. You either have a brain of a migraine or you don't. You know, like I said, if you have a brain, you can get a migraine. Anyone can.
But if your mother or your grandmother had them, you're probably more likely to do it.
Exactly.
And
Exactly.
speaking, we're talking a lot about women. Women are 3 times more likely to have them than men. I feel like I'm asking, I keep saying, "But why? But why?" Hormonal changes, why? Or we is another one
That is
for you?
the thought. That is the thought. The thought is that because we have estrogen, estrogen can be very uh, irritating in terms of provoking migraines. In fact, once women go through menopause and they no longer have estrogen around after age 65, and especially those who have had strong hormonal component to their migraines, usually can look forward to being migraine free.
Really? That's so interesting.
So if you had very strong hormonal component to your migraines as a woman, you knew like I'm gonna get migraines during my cycle or
Yeah.
by ovulation or right before my period. And you didn't really get that many outside of that, or not as many or not as much, most likely you'll be fine.
Wow. Wow, that's amazing.
I know, but you have to
I mean, that's
wait.
that's a long wait. So let's yeah,
Yeah,
talk about what we can do before then. In terms of real world impacts,
right.
what do you see as a neurologist when someone comes to you? You know, you said, well, they may happen right with your cycle. Maybe they happen every now and then. By the time someone comes to you seeking help, what is happening in terms of their life? Missed work, difficulty parenting, mental health impacts. What is it that's happening that generally gets them to you?
So I see a whole spectrum of folks. Some are lucky enough that they have experienced migraines through their relatives or friends. And so they kind of understand the disorder already somewhat and have tried a bunch of things. Or they've had a really proactive primary care doctor or OBGYN who picked it up and has been treating it very well, or have seen already some neurologists outside of my practice. But there are those that I was explaining to you that come to me with eyes wide open, that they're really scared of what's happening to them. They may have brain aneurysm or a brain tumor or a cancer. They seriously are anxious. And then the first thing I tell them, well, listen, the one thing that we don't want is for you to be anxious because that's definitely not going to help your migraines.
Right.
Right? So let's get to the bottom of what's happening to you so we can make sure that whatever fears you have, we get them, lay them out on the table right away, and you tell me what you're scared of. What are the diagnoses you're really concerned about? And sometimes it comes up, oh, my grandmother had an aneurysm, or
Yeah.
my mom had, stroke, or, that is very important to elicit in the patient with a migraine right away.
And there must be
Be-
some things you have to rule out, right? Like you were telling me you want to rule out red flags. Like if it's
exactly.
what is it? It's the speed that they come with and how they feel. If there's confusion, that would tell you. So, like, what are the red flags you're
Right.
looking for?
Right. So when we look at the patient with a headache, there are primary headaches and secondary headaches. Primary headaches are those headaches that are not going to kill you or hurt you.
And a headache is a more general term, whereas a migraine is more specific within the headache category. Is that right?
Correct.
Okay.
Correct. So secondary headaches are those that are caused by either infection or trauma or some or brain tumor or something else that is an underlying condition or disease that you don't want to miss. And by treating that underlying condition or disease, the headaches will get better as well. Um, and then the migraines, tension headaches, cluster headaches, some people have heard that otherwise don't have any secondary cause, they're considered primary headaches. They're still disabling for some people, but they're not going to, thankfully, be dangerous to their health overall
Right.
immediately or directly.
Okay, so if we're talking about diagnosing headaches versus migraines and how to understand what's going on, then there's some red flags that you try and rule out, right? In terms of how
Correct.
fast it comes along or what comes with it. What are the red flags that you rule out? And then how do you diagnose a migraine?
Right. So the red flags, number one is, have you ever had this headache before? Like this, like the way it felt? And how quickly did it come on? So if the answer is no, I've never had a headache like this before, this was the worst headache out of my whole life, and it came on within like 0 to 60 within like a few seconds, that's a call 911.
There, we're gonna go check and see if something else is going on.
That's a no, that's a call
Right
911.
away? Okay.
Yeah, so if those 3 things have occurred,
Okay.
never had anything like this before,
Worst of my
like
luck,
never worst headache of the life and 0 to 60 in 1 second or just a few seconds, that's a
an
911.
emergency,
Don't even and it's not just something that happens and goes away, but like boom, and it's
and
there.
it's there. Okay,
911.
okay,
Don't even go any further.
got
That's all.
okay.
The
So
other
a
red flag.
migraine by comparison then, I'm gonna guess, comes on slower and you've had multiple? Are those some of the big
It's very rare for a migraine to come on from 0 to 60 in 1 second.
okay.
Most of the time, migraine would come on gradually. And if you're very observant and you've had it several times and you've start paying attention, you will notice certain symptoms even before you get a headache. And it's basically, I explain it to my patients is your brain becomes really irritable and annoyed. Your mood may change. Everything seems like it's too bright or too loud, or the smells are too strong, or just people around you just starting to annoy you, and you just want to be alone in your own little
And it's gonna
quiet
last for a few
space.
hours. It's gonna last a while, generally?
In some people, it may only last for maybe 15 to 30 minutes,
Okay.
this sensation. And in some, it may be a very long prodrome. It may be. Now, also, some of these symptoms may not come on always. In some people, headache will be the first thing that will happen, unfortunately. But in majority, there is something that may start happening, or even you may start craving chocolate potentially.
Hmm,
Yes, or you may start yawning. You may start feeling sleepy.
really?
That's how strange it is. It's like I feel like that every day.
And what
Comes 3 p.m. I want to take a nap
yeah,
anyway. Well, it you need to start paying
paying
attention.
attention to those signs.
Yeah, do you get a headache in close proximity to feeling those symptoms? Washed out, feeling really fatigued, or maybe starting to really your focus, your concentration is just not becoming very good. You start to really not being able to process what's being told to you very well. Um, or the words may not come out exactly the way you want them to gradually, not yeah.
One of
So
the things that seems so hard about this to me, and I don't really know why it is, but it feels like the world is not very understanding about migraines. I don't know. Tell me if I'm, but I feel like it's one of those things where if someone says they have a migraine, very often they may not be believed, or someone may roll their eyes or be like, "Oh, not that again." Like I don't like if someone had a sprained ankle, I don't feel like the world is so difficult about that, but it doesn't feel like the world is great about understanding how debilitating these are. Do you agree? Do you feel like we're in a good place with that?
I agree. And in general, with brain disorders, it's so hard for a lot of people to understand them. But they're, in general, majority of brain disorders you see are not as common as migraines. Migraine is probably, especially in the young population, the most common brain disorder.
Wow.
And that's the tough part about it, is that sprained ankles, you see a swollen ankle, you see that it's swollen and you see a person tripped. You can't see migraines. You have to believe what a person is experiencing. um Really, the only objective finding you may see in a person who's having a migraine is that they throw up,
Yeah.
right?
Wh-
What else are you going to see I mean, that you may see they're pale.
Yeah.
Usually they're washed out, they're usually pale. They don't look like they're happy campers.
Yeah. They don't look like they're feeling well.
They're not feeling well,
I know
yeah,
as a
but
neurologist, you're really passionate about treating migraines, and I'm going to stress the word treating. Why are you so passionate about that?
well, when people need to be educated about something to feel more empowered and optimistic and get their life back, I'm always very passionate. I think as a doctor, you have to be a good teacher. I think it's part of being a good doctor. And to be a good teacher, you have to be passionate about teaching. And so for me, when I know that what I'm teaching is going to have a direct impact on how someone is going to feel and their quality of life, and that they'll be able to prevent and abort uh, the migraines and get their life back in a meaningful way, especially when they're young and healthy otherwise and full of responsibilities, parents, or,
Whatever. Yeah.
employees. I mean, this is us. This is our working society that deals with this condition.
So you're
How can
saying
we
there
function?
are solutions, because I feel like that's another part of the conversation that I don't know if we hear that much about, or it seems like finding the solutions is hard for people. Maybe that's because the migraines keep coming back. So let's
Right.
talk about what to do about it. Let's start with lifestyle and non-pharmacological approaches. What are
Right.
some of the best things that people can do?
Well, never underestimate importance of sleep. Never underestimate importance of stress. So S and S, right?
Managing both. Yeah.
When I have a person come to me for migraines, I ask them, when was the last time you had a day off? When was the last time you went on vacation? How were your migraines when you went on vacation? How'd you do? Majority would say they felt much better. There are some, unfortunately, that feel worse, and that's usually because either there was a jet lag involved in their vacation, right? Or maybe they were using a lot of alcohol during their vacation, or maybe their sleep cycle was majorly interrupted in some other way. But majority, when they are resting, they're able to get enough sleep and take some of the responsibilities off their shoulder to relax, they will start feeling better right away.
You
Because
mentioned alcohol. I know hydration can be really important in terms of what you eat and drink. How much does that come into play? And can you just reel off things for me that are good, or is it more tailored to an individual person based on what they're consuming regularly?
yeah. So in general, if you're getting frequent migraines, you want to sort out exactly what you're doing every day that may be triggering your migraines. And the easiest thing to do is to get yourself into a regular schedule. Do the same thing every day. Because when you're doing the same thing every day and something out of the ordinary happens, then it will be much easier to figure out if that was influencing your migraines. But in general principle, regular sleep, regular meals, and if you're going and lots of hydration, at least 6 to 8 glasses of water every day if you're not exercising and it's not hot.
Mhm.
Um,
More if
e-
you're doing either of those things.
exactly.
Okay.
And then also in terms of caffeine, which most of us like, if you are going to have your caffeine, try to have the same amount every day and no more than 2 cups of coffee or 2 cups of tea or whatever other caffeinated beverage you have outside of high energy drinks. I don't count the high energy.
You shouldn't be drinking those if you have migraines?
Well, it depends which one. I'm not going to say no to any,
Okay.
but you have to understand, is that something that could be potentially triggering your migraines or not? Uh, that's the thing about migraines, is that there are some common principles like stress and sleep and dehydration that can trigger them, hormonal changes, but other triggers, they are unique to each person. And for example, I don't know if most of you have heard of monosodium glutamate,
Mhm.
MSG.
Yeah.
It can be a really significant trigger for some people, but for some, they don't care.
Not at all.
They will eat it all day. They will never get a migraine, but then they'll have their period and their migraine will be crazy.
Wow.
So, yeah, so that's why I don't like to be kind of very black or white,
trick.
very black or white,
Yeah.
telling people never do this or never do that, but some common principles apply. And then exercise actually makes you more resilient to everything. Everything means not just migraines. You strengthen your immune system, you promote sleep, you improve your emotional health, um, you improve your hormonal symptoms, whatever they are. So I tell every person with migraines, if you can manage to exercise at least 2 to 3 times a week, it doesn't have to be a lot, but you have to start somewhere
Mhm.
for at least 20 to 30 minutes. Just get your heart rate up into 120s, 140s for 20 to 30 minutes, 3 times a week. Just start there. And it's going to be beneficial in so many ways, including your migraines, most likely. Like I, I never hesitate to advise that. So
Okay.
those are the main lifestyle,
Okay.
you know.
I feel like we could do a whole episode just on medicines alone, and we don't have time for that. So, but in general, when it comes to medications, you've got ones that can treat something in the moment, and you also have preventative ones, right? In how well do those medications work for people?
So the simplest treatment for migraines, over-the-counter, non-steroidal, anti-inflammatory medications. That is actually a first-line medication for migraines. And majority of people actually will respond to these pretty well, interestingly. Even Tylenol works. I tell my patients, just if you have never tried anything, because majority will like, I don't want to take medications. I just pull the cold compress on my forehead and I lay down and I suffer. I'm like, well, why are you suffering? You can take a over the counter pill if it's not contraindicated to you, and majority of people, babies can take Tylenol, so at least take that. And you can take 650 milligrams, or you even can take 1,000 milligrams. If you're not combining it with alcohol, you're good. um, and of course there are other like ibuprofen, naproxen, all of those, excedrin migraine. um, Always talk to your doctor if you're not sure, or to a pharmacist. Even the pharmacist can help you with the side effect advice on certain medications. And so, but when these medications do not help, and the key is to start treating migraine early. As soon as you start getting the symptoms,
Right away.
that's when these over the counter medications, especially, are most helpful. If you take these early, they will work usually within 30 to 40 minutes. But even if, and then going to dark room, usually drinking lots of water, closing your eyes for 15 to 20 minutes, just kind of just relaxing, that will be very helpful. But if in 30 to 40 minutes you're not better, and you are really in pain and you're really disabled, like you cannot function,
And this is
that
happening over and over and over again. That's when someone would probably come to someone.
then yeah, then you need to have a prescription medication. And the older medications for migraines in the class of triptans, sumatriptan, rizatriptan, elatriptan, there are many of the triptans. Um, they have been our major game in town for many decades, until new girl and boy on the town appeared, which are calcitonin gene, uh, CGRP,
Mhm.
basically calcitonin gene related peptide based medications. Um, see, handful, mouthful. So this calcitonin gene related peptide is a chemical that was discovered a few decades ago that is known to participate in the pain cascade in migraine. Uh, the triptans, they are more based on serotonin based um, trigger of migraines. So they work on 5-HT receptors. The calcitonin gene related peptide medications, they work on anything related to that peptide, that protein. And so there are classes of medications that directly block receptors on which this peptide works, or they modify how that protein works otherwise. And there are those that work during the actual migraine attack, and there are those that prevent um, activation of receptors of this by this chemical for a whole month. So you inject them once a month under the skin, and you're good to go for a whole month.
And it reduces the likelihood of them happening or the intensity if they do? Which
Both.
one?
So
Both?
all preventatives, they work by preventing the attacks and or making those attacks that do come on more manageable and less intense.
It seems like there's a lot you can talk about if a patient comes to a doctor, because you also have, some really interesting research on wearable devices these days. There's AI being used to track triggers, there's beta blockers, there's Botox. It seems like there's a lot of options if someone comes and talks to you. You mentioned, though, the fear that comes into this and just how, the emotional piece of it. If someone has migraines, are they going to have them forever, or will treating it with some of these things, is it possible to have migraines sort of in your past, or are they always going to be with you?
So as I explained, majority of people will not have migraines as they get older. Unfortunately, there is a population, it's a smaller population, much smaller percentage that still does have migraines as they get older. But there are safe and effective treatments for all populations of migraineurs these days. And that's the beautiful thing. Even when I started practice, we really didn't have many choices for pregnant women in terms of safety to treat their migraines during pregnancy. Now we do. We have devices, we have medications that are preventative and abortive that help and make it manageable. It's so sad. 25% of women who have migraines will delay their pregnancy because of their
Mm.
migraines. So now we have solutions for them. Okay. Um, and for elderly, for those folks who have had strokes, heart attacks, for whom we were so concerned about using these sumatriptans or other triptans, for example, now we have these CGRP medications, which are much safer and much less likely to cause any issues in those people. People with chronic pain and being on other pain or sedating medications where we didn't have good choices in terms of preventatives before, now we do. Now we do. And devices also. Uh, Especially now, I am very happy to be able to bring all of this information and education to my patients and alleviate their fears, giving them the power and hope that they'll be okay, that even if they're not going to be 100% migraine free, they will take charge and be in charge of their migraines, and they will succeed and they will win in the end.
So
They'll be okay.
the main message here sounds like there are solutions and a lot of them.
Lots,
So
lots.
don't suffer in silence at home in
Do not, do not. And we're trying to educate a lot of primary care doctors now in all these tools because migraines are so common and it's not always easy to find a neurologist. And so we're hoping, just like many other common conditions such as diabetes, dementia, that migraines will be also a primary care type of issue that primary care doctors will be able to handle at least somewhat in the beginning before they will seek a consultation with a neurologist because migraines are so common and patients deserve to get the right treatment right away because the longer you wait to get the right treatment, the less likely your migraines will be easy to treat, the more likely they may become chronic or intractable. And we don't want that. We don't want that to happen to our patients.
So
We want them
seek
to
help,
prosper.
talk with the primary doctor first, explore options, and don't suffer in silence. Dr. Ackerman,
Yeah.
thank you so much for your time. This was really helpful. Appreciate all your insight.
Thank you, Jenny. Talk to you soon.